Okay, so today we're going to be talking about cryotherapy and applying it to a patient. So our patient is Jimmy. He has had a cast on his leg for 6 weeks. He had a patella fracture in his knee, so we're going to be doing cryotherapy to help with that. Since he's 6 weeks, since the injury, he's probably in the fibroblastic repair stage. He also could be moving into the maturation and remodeling phase as well. Some indications to help you know when you need to use cryotherapy is acute pain, or acute or chronic pain, and then acute swelling, and that's because the cold packs can help constrict the vessels in the blood vessels in the affected area and decrease some of the fluid and blood running to the area, so it'll overall decrease swelling. Contraindications are you don't want to be using cryotherapy on an area of poor circulation because then the cold will also decrease the circulation or decrease the blood flow going to that area as well. And then a precaution that you need to be aware of is not applying a cold pack to an area of poor sensation, because the cold pack does have the ability to burn the patient if it's on there too long and if their tissues get too cold. So I'm going to go ahead and make this cold pack now. So you just need one layer, so you get this out of the freezer, and then you just wrap it in a towel or a pillowcase for one layer, and then get a band so you can wrap it around the affected area. Okay, this is Jimmy. What's up, Jimmy? Okay, so how's it going, Jimmy? I'm Justin. I'm going to be your PT today. So we already worked with you a little bit with your knee today. We're going to finish up some physical therapy by probably doing some cryotherapy. So I'm going to just check your knee, see how it's looking after the therapy we've done. Is that okay with you?
Yep.
Okay, cool. So I see, looking at your knee, I see some swelling around this area, and it's probably due to some of the exercises that we did. So there's some swelling in there. So what we're going to do is we're going to wrap it up in just like an ice pack or a cold pack, and that will help to decrease the swelling that's going on and also decrease any pain that you might be feeling. So does that sound like a good idea?
Sounds good.
Okay, awesome. Okay, so this is just a cold pack wrapped up in a towel. And I'm just going to strap it a little bit tighter so it can just cool off the area and compress it a little bit more. So, and then we're going to be leaving this cold pack on for about 15 minutes. So, but I want you to, I want to let you know that at first it's probably not going to feel super cold, but in a few minutes it'll get cooler and cooler.
All right.
And then we want it to feel cold, we want your knee to get pretty cold, but we don't want it to hurt you or cause any pain or burn at all. So if you start feeling any of those indications, then feel free to take it off and set it aside. But I've got a bell here in case that happens. So if it starts getting too cold, go ahead and ring that. We'll come back in. And then I'm going to set a timer for 15 minutes on my phone here. And then I'll come back in a few minutes and check on you. Does that sound good?
Alrighty.
Okay, sweet. How's it going, Jimmy?
Pretty good.
How's your leg feeling?
Feeling all right.
Yeah? Okay, let's go ahead and take this off. Was it too cold at all? Did you feel any pain or burning?
No, it's perfect.
Okay. Okay, and then I'm just going to check and see how it's looking. Looks like some of the swelling has gone down a little bit. Are you feeling any pain right now?
No.
Or as much pain as you were feeling before?
No.
No?
Feeling good.
Feeling good? Okay, awesome. Thanks, Jimmy.